Whitney, thank you so much for coming onto my show. I'm so excited for this conversation. Welcome to the podcast.
Thank you. I'm so excited to be here.
Okay, so today's episode is going to be a little bit different than I've ever done before. I kind of want to create like a mock patient to really see how a dietitian would educate and counsel this patient. So my listeners who are typically primary care providers, PAs, and dietitians can actually see the conversation for two very different patients. So I'm going to set up the first patient scenario and then we'll go from there. So I am a 45-year-old woman. I am married with 2 kids. I work as a bank teller and I am here for my annual exam. And I really want to discuss my weight because I want to lose about 30 pounds for an upcoming wedding that I have in a few months. So my question to you with this patient sitting in front of you is, what are the first things that a provider should be doing or asking or thinking about in starting this conversation with the patient?
Number one, you have to look at their situation first and you have to consider their life. I think all too many times we kind of just jump in. We don't consider their life or their schedule or what's going on at home. And we just jump in and we just spit out recommendations, spit out goals, and they're nowhere aligned with what they can do. So, taking a look at her life in general, she is a busy mom. She works full time. She's got 2 kids and a husband or a partner. She wants to lose 30 pounds. She's there for her annual. So, first things first, I would ask about her lifestyle. So, if we're talking about nutrition first, how many meals a day do you have? What's that look like? What is your protein intake? See if we can get a 7-day food recall if you would like. A lot of times, that 7-day food recall is not going to be highly accurate, but you can at least get a general idea of what is in the bulk of their diet on a more consistent basis. Other than nutrition, how much sleep is she getting? What is her stress level like? More importantly, what is her exercise and movement like? So we talk about nutrition so much and cut this out. Don't eat this, don't eat, don't. But we're not talking too much about exercise. Yeah, we say you need to exercise. You need to do 150 minutes a week and then 2 to 3 days of strength training, but they have absolutely no clue where to even start. So, basics is best to start off with. What's your protein like? What's your general calories like? Are you moving? Those would be the 3 things that I would tackle first. But additionally, the sleep and stress management, because we all know how huge of a role that plays in weight maintenance and health in general.
I love that you set that foundation to ask questions and get to know your patient. That's a very important first step because it will actually eliminate some of your burnout. And if you
Mhm.
think about it, if I'm finding out about you, Whitney, and I'm learning, that maybe since you're so busy, you're eating out all the time and you do have 2 or 3, coffee drinks because it's in the break room and they have your favorite flavored creamer for the holidays. Well, instead of me saying like, oh, well, why don't you just eat breakfast and giving you really useless information, which is going to exhaust me as the provider, I can just ask you what are 2 or 3 areas that you're struggling with. And you're giving them to me. And then all I have to do is reflect that back and give you 2 or 3 suggestions to really fix that target issue and challenge that you're dealing with. Because now you're not just spinning your wheels, spewing out useless information that is not really helpful for the patient. And you touched on the other things. Yes, it's about nutrition, and that is the goal of my podcast, but it is also about stress and sleep and movement. So I really love that you carry that in and have that be part of sort of the initial intake and the questions that you're bringing up. My favorite thing that you recommended is that recall. It's so important because that gives you such good, helpful information. And like you said, yeah, it might not be totally accurate, but you can see some patterns. So I think that's a fantastic place to start. So my next question when we're working with our mock patient is, what diets should we even be talking about? It's a big topic. There's so many different fads out there, but for someone who may be working in a weight loss clinic and they have this, woman coming into clinic, where should their mind be going with what diets or dietary patterns they should provide as an option for this patient to help her lose weight?
My go to is high protein and high fiber. If we focus on those 2 things, we kind of cover a lot. So, if we are addressing their protein, we are helping them to stay fuller for longer. We're fighting cravings. We are helping to maintain and build muscle. So, there's a myriad of things that we want to achieve with protein alone. So, if we can get them to eat a high protein diet, that's going to be first and foremost. And so that leaves the other macros, the carbohydrates, the fats. We do have to educate on healthy fats, but that's not ever my first go to. I don't want to prioritize fats at this time. So we go protein first. Second would be carbohydrates, identifying those carbohydrates, which ones are high fiber. So if we are choosing ones that are high fiber, we are making sure that our net carbs are very low, where are the active carbs that are affecting blood sugar or excess weight, water weight, excess fat. So we're kind of eliminating that. So high fiber with carbs and high protein. That's always my go-to.
I want to linger here a little bit. When you say high protein, for my
Mhm,
listeners that are not dietitians, what
mhm.
does that mean? Is there a quick calculation that they might be able to do? Because especially if they tell the patient, hey, eat high protein, then they're going to go down the Google rabbit hole and get onto some, bro dudes carnivore diet. And they're suggesting 1 gram per pound of protein. So give us what the current guidelines are and how we can properly educate our patients on exactly what we mean if we do say high protein.
So I'm not your typical dietitian. I normally never go over calculations with patients. Number one, they're not comfortable with calculations. They don't even like to track their foods for the most part. Now, we do have that certain percentage of population who are gung ho and they want to learn, they want to experiment, they want to track everything, and that's wonderful. But the majority of this population is too busy to do that. And I recognize that. And we have to meet them where they are. When we're talking high protein, we can talk both animal based foods and plant based foods. So high protein animal based foods, we're talking lean chicken, like chicken breast. We're talking ground turkey, highest quality beef possible in the leanest version. Fish is phenomenal. If you have someone who likes fish, really optimize on that because they're going to get healthy fats too. Anything that is a byproduct of an animal, so cottage cheese, lower fat cheeses, or, even just regular cheese in moderation that's higher in fat. And then in the plant-based world, so we've got certain plant-based foods that are higher in protein, that are complete proteins on their own, like edamame, quinoa, beans, nuts, seeds, legumes. Those are also going to be high fiber, so we're not worried about the carbs as much. But those would be the most ideal proteins. And as far as calculations, like I was saying, I try to stay away from calculations as much as possible. I learned this in the bariatric space when I worked in the clinical setting with them, counseling them. And as soon as I would throw a calculation their way, they were like, "Meh." They didn't want to do it. And so I started off with a base recommendation of sixty grams a day for someone. And surprisingly, even though that 60 grams of protein may have been very low for them to optimize weight loss, you have to understand, like, they're not used to planning for 60 grams of protein yet. Like, if I all of a sudden said, "Hey, your actual recommendations are 100, but you've only been getting 30 grams a day," like, that's way too much at one time. So I start them off at a base goal dependent on what I see that they get consistently. So we just keep increasing it until they get to the point where they are used to planning for their protein. I provide protein planners. And that way, it's more of a systematic way of taking a big goal, breaking it down into smaller increments throughout the day. So say they have a goal of 100 grams of protein a day. If I'm suggesting you eat 5 small meals a day, then 100 divided by 5, that's 20 grams of protein per meal. Can you aim for 20 grams of protein per meal? And that makes it a lot more simple. And whenever it comes to the time for them to increase, they could add a couple of protein shakes in between just to boost it in a very easy, simple way.
So you don't give your patient a target of 95 grams. Let's just say you need to eat 95 grams of protein every day. If you don't do that, do you suggest certain food groups that they eat at every meal? Because if you're telling them to eat a high protein diet, what's that education look like for them?
So if I'm telling them to eat a high protein diet, they're getting a protein planner from me, for instance, and they have a list of protein foods. So it'll say for the recommended serving size, let's say 3 ounces of chicken, this is going to give you 28 grams of protein. It's this many calories. So ahead of time, they can actually educate themselves to see, okay, what foods do I currently like? I'm going to go through this list and mark next to it. I know I can incorporate those. And then what foods do I know I like, but maybe I don't incorporate them that much? Let's say canned beans, about black beans, for instance. They love black beans, but they never really have them. Now they realize this is a great source of protein, so they can start throwing beans on salads. They can put it in soups and stews. They can make a bean salad. They can put it in their tacos, you name it.
I think that's a smart approach that will take a little bit of mindset shifting on the provider side because even in pediatrics, when we talk about portion sizes for infants, parents are like, but exactly how much should my baby be eating in pureed foods? And I'm like, I can't really give you a number because it is going to be different for every baby. And I don't want you to fixate on that. Right. And so I love that approach with protein with adults too, because you've got kind of like two ends of the spectrum. You've got someone who might really fixate on that versus someone who that's going to be really, really overwhelming for. So I think for the listeners, a really helpful takeaway point from this is find, a sheet that has some protein rich foods and maybe how many grams of protein is on each of those. Hand that to your patient. That's their homework for the week. Hey, just circle the protein foods that you like right now and maybe in a different color ones that you like, but you haven't tried. And then come back to me. Or here's a referral to a dietitian who can really help you package this and create your meal plan for how you would incorporate these foods. I think that is a fantastic piece of education to give to your patients.
Yeah, and I can give you the protein planner and the protein list, but this is a wonderful tool for providers to give to their patients. I would say out of all the things that I tried in the clinical space, and counseling, this is probably the most successful way I have found to get them to meet their protein needs.
Winnie, that would be amazing. So I'm going to go ahead and link to those in the show notes so you guys can check those out later and use with your patients. I want to move on to talking about some simple swaps that can actually provide huge results for patients. And in my mind and coming up with this question, I'm thinking like sugar sweetened beverages that patients often forget about that they add calories. And I always tell colleagues, hey, if you don't ask, the patient's not likely going to tell you. So I think when you're doing that diet recall, you really do need to ask, like, what are you drinking throughout the day? And, maybe working on simple swaps for that. But like, what other swaps do you discuss with patients when you're trying to lower their calories or maybe even just lower their sugar intake?
Yeah, I love that you brought up the sugar intake. I would say that's probably a very large culprit in a lot of people's diets. That's one of the assessment questions that I will ask and I point out right away is I want your awareness of added sugars to be there. And if they're not aware of what added sugars are, we have that education, but I have them start tracking added sugars and some of them would be 75 grams of added sugars a day, maybe 100 grams of added sugars. The American Dietetics Association says limit at 50, and the American Heart Association recommends 25 grams of added sugars per day for your limit. So I go with the lower. I don't want it. Why would I want my patients to have 50 grams of added sugars when, when we could limit it at 25? So when that awareness is there, you can really kind of dig into your own diet and be like, okay, now that I'm aware of what items have a lot of added sugars in them, then I can kind of go through my day and my week and see where that lies. And a lot of it is in coffee. So a lot of people are very dependent on their coffee. They're not willing to make changes for the most part because they look forward to that sugary hit. And, when we're talking substitutions, let's just use Starbucks as an example. Instead of having a venti frap and you're not willing to change that frap, then get a tall frap. Small changes. We don't have to totally eliminate things all at one time. We can make gradual changes, go for the one that's a little bit better. And then when you're used to that, go for the one that's a little bit better than that. So there are options everywhere. I don't care if we're talking about McDonald's. I don't care if we're talking about Starbucks. There are always a healthier option. It's just a matter of being willing to do that. And if we can frame it in the way, we're not taking it away from you. You actually have to shift that mindset as to what is the sugar doing to your body? How is it holding you back? What's it doing to your brain? How is it affecting your sleep? What's it doing to your cortisol levels? What is it doing? Sugar plays such a phenomenal, in a bad way, role in our bodies. Like, we just have to address that. So simple swaps for Starbucks, making your own coffee at home. Sodas, I always recommend a carbonated beverage. If you don't have GERD or acid reflux, or if you've had bariatric surgery, then carbonated waters are a wonderful, wonderful substitute for sodas. So there's always going to be some kind of alternative that's a lower sugar because we are in the lower sugar, low carb world. There are options everywhere. It's just a matter of taking your time in the grocery store, looking at your other options, or doing some research online. What's the healthier version of this?
I love that. I think those are really helpful suggestions. And I would say in my work too, in my experience, it's almost always the coffee drinks that do add up that people are just shocked with how much sugar is in there. So I agree with you. If you can make it from home, saves money and a
Mhm.
lot of calories and sugar too. So those are really helpful. Okay, I want to close out this patient case with sort of a talk on how do we actually switch the conversation to not just about weight and weight loss and in all age populations, but I think this age of our patient, she's 45, right? So she's perimenopause. I think it's really important to really take that spotlight off of weight and weight loss and focusing it on health and longevity. And so it's a kind of a two-part question. Like how do we do this? And especially in this patient, what other considerations should the provider be thinking about regarding this specific patient's health in that perimenopause phase?
I like to dig into a patient's why. So if their why is merely, I just want to look good in this pair of pants, or I just want to be skinny, like that's not enough of a why to succeed with obesity medicine or weight loss in general for any long term period of time. So, if their why is something beyond weight, like I want to walk Disney without taking a break with my grandchildren, I want to fit on a roller coaster ride, I want to sit in a airplane seat without the seatbelt extender, I want more energy, I want to feel stronger. Like we have to ask exploring questions so that we really can dig into their pain points. If you can't identify their pain points, probably nothing is going to stick. So, really dig into their pain points first and foremost, but also don't even talk about weight. Like whenever I'm counseling someone, y'all are going to think I'm crazy. I do not ask for, of course, in a general assessment, I ask what their start weight is. But when I am following up with people, I'm not asking for their weight. I'm asking, what does your nutrition look like? What do your calories look like if they're tracking? How many hours of sleep are you getting? Rate your stress on a scale of 1 to 10. If it's above a 5 or a 6, I'm asking them, what are you doing for stress management? And it's all in lifestyle. So if I address everything within the pillars, the exercise, the mindset or behaviors, the nutrition, if I'm addressing all three of those things, then the weight comes naturally. So if we really hone in on habit setting, how to forget old habits, how to create new habits, how to create a consistent routine. That's what it comes down to. They have no clue how to plan their mornings, how to prioritize self care throughout the day, how to cut out chunks of time without feeling guilty. Perimenopausal women or menopausal women, their hormones are going crazy. So, the things that we need to do to support hormones or healthy hormones is a quality nutrition and adequate sleep and exercise. So still we're coming back to the lifestyle changes. And if we get all those lifestyle changes buttoned up, the weight comes. There's no way around it.
I agree with you with everything that you said. And I think that's the healthiest way to approach weight loss, right? And it's backwards because, like, yeah, we're going to help you lose weight, but we're not even going to be talking about your weight. It's just kind of funny how it does happen because once that patient starts creating those healthy habits and it becomes more routine, like you said, the weight loss will just naturally come. And I
Mhm.
think our culture is so focused right now on weight loss that we are forgetting, like, we need to have gut health. Like, is your patient pooping regularly every day? We also need to focus on bone health. Like, is she getting enough minerals from her diet, or is she on this completely obnoxious, low calorie, low fat, low carb diet that she's missing out on a ton of vital nutrients that maybe 10 years down the line, now we're battling osteoporosis, right? So, there's so many other things when it comes to quote like medical weight loss that I think we are missing the target on because we're just so focused on that final number on the scale that we're doing a disservice to our patients.
Right. And I want to talk a little about compassion too. When they're coming to see you in the clinic and they're there for weight loss, obviously, all they've done their entire lives is obsess about their weight. They obsess about the scale. They obsess about the word weight. They obsess about the word obese. They're ashamed. So for them to come in and still again focus on the number or their weight or talk about BMI, which is just completely ambiguous, it's not right. We really have to address it in a compassionate way. Like, I know you've been dealing with this for all your life or since you had your kids or, whatever. Or as you've gotten older and you're approaching perimenopause or menopause, you're gaining weight. The compassion has to be there. And, if we can kind of sideline the weight conversation and get more in tune with just getting to know the patient and address the low hanging fruit first. There's no reason they have to address all this stuff at one time. So just kind of presenting expectations in an achievable and approachable way.
Yep, it's so well said. And I've learned throughout the years of going through like behavior change models and strategies. And they're the number one thing that you can do to help your patient be successful is to build a connection with that patient. Because if
Mhm.
they know and feel that you see them, you hear them, you value what they have to say, they're going to be so much more successful than a provider who just is like, oh, you want to lose 20 pounds? Here's your prescription. Here's a diet to follow, and I'll see you in 6 weeks. That's
Mhm.
just really cold and stale. And I don't find that it's very effective at all.
No, it's not.
Okay, so that was so fun for our perimenopausal mom. I want to move on to a completely different patient because nutrition is very nuanced and what works for one patient might not work for the next. So, our next patient that's coming into the room is a 57-year-old male with type 2 diabetes, obesity, and hypertension. I was previously on a weight loss medication and we'll just use Wegovy for ease of conversation. I was on it for about 10 weeks and I lost about 20 pounds, but I've gained it all back and some. So I'm here looking for some guidance. So, my first question is help us understand this challenge. This patient is a lot of our patients, right? Why is it that some people tend to gain all the weight back and some, or even just struggle to lose weight, in the first place when they decide to go on this weight loss journey? Like, what is happening within them?
I mean, there's so many factors that come into play here. Genetics, lack of awareness of their intake, poor nutrition education and intake, sedentary lifestyle, stress, poor sleep, lack of motivation. But number one, I think, is inconsistency. So let's just assume he went to the doctor, he didn't get any education, he tried Wegovy. So 10 weeks isn't a lot of time. I mean, I would question, well, why didn't that work out? Were you not taking your medicine like instructed? Did you not feel well? Did you have your appetite just totally taken away and you weren't eating anything? Like, there's a lot that I would like to know behind that. But I would say, if he had stopped and then he all of a sudden gained his appetite back, maybe he didn't continue his exercise if he even was exercising. So 10 weeks is not a lot of time to do learning or application or even practicing consistency. So I would question, how did you start and how did it go, in the beginning, and where did we fall off?
All such good points. And you're right. Like, it's, it's like such an easy question with such a complicated answer because it depends, like there are so many more things and pieces of information that you need to gather from your patient. And I hope that my listeners are realizing that through each podcast episode is as like all of my guests and even me when I'm teaching, I don't just answer the question. Usually there is a follow-up question because I need more information before I can give the patient the best education for them because it might be different, right? Like you said, maybe he did have horrible side effects and he hated the medication. And so we need to address that, especially if you're thinking about re-prescribing a medicine. You need to talk about side effects and set him up for the best success and maybe talk about how to handle those side effects. Or maybe he was inconsistent and he was on a really just horrible quote fad diet that was really hard to adhere to. So once he came off the medication, his appetite just went crazy and he went back to his old style of eating. And that's a completely different approach that you need to take for that patient.
Yeah.
So let's say for him he had some side effects from Wegovy. He didn't like the medication. He also did not have any education. He was not working with a dietitian, so he kind of was trying to figure out this high protein diet, which is pretty much what everybody is suggesting when patients go on these weight loss medications. He was trying to figure it out on his own. So, what are some really easy, quick tips that we can provide him in the clinic that would set him up for success moving forward, especially related to his diet?
I would definitely recommend pointing out what are the foods that he needs to be focused on. Like pick five. Pick five proteins that he likes, and that's what he rotates all the time. Pick five different colorful fruits and vegetables that he likes and rotate those all the time. Make these lists very simple and achievable. Pick one from the protein, pick one from the carb, and if there's a healthy fat, it may, fit within the protein or carb, or it could be separate on its own. So making things as simple and as elementary as possible would be absolute best. And that's how I do every bit of my education. It's as if I'm teaching a sixth grader because that's kind of where our minds lie, even as adults. We're children in adults' bodies. And unless we learn something that furthers our education, especially in nutrition, we just don't know. You don't know what you don't know, right?
Mhm.
And give them trackers. I mean, he needs to be tracking something. If the awareness is not there in terms of how much protein are you getting or how many steps are you getting in a day, then that can be quite, it's just aloof. You're just doing it. You're just making the movements. You're not really following up or accountable to yourself. So, some kind of a tracking system, planners for sure, and how to plan his day. So, this is kind of one of the things that I provide too is a daily planner. He knows his work schedule, he knows his obligations, but in terms of a lifestyle planner, what is he doing for protein each day? What are his choices for carbs? How much hydration is he getting? How much sleep is he getting? What is he doing for stress management? All of those things, I think when we have trackers that actually put something on one piece of paper, one page that actually has everything that you can see in a nutshell of the things that you need to be focused on a daily basis, the more you look at it, the more it's in front of your face, the more you notice it and you're aware. So just something simple he can have with him at all times that tracks the major things just to get him started.
Really helpful. I love the first part that you had mentioned that was like, hey, let's pick 5 protein, 5 veggies that you can eat, and we'll kind of show you how you can mix and match because I think that works really well for patients. I mean, you probably have done this because you've been a dietitian probably as long as I have. When I first started, I would literally hand write out a meal plan, right? Like, this is what you can have for breakfast, your snack, your lunch, dinner, snack, for 2 weeks straight. And it took so much time because we didn't have AI. We didn't have the tools we
Yeah.
have now at all. And I know you're going to nod in agreement with me. What happens when I would check in with the patient in a couple of weeks? Oh, yeah, I went out and yeah, I didn't really eat any of that stuff. And it's like, oh my gosh, what a waste of time on my part. And it wasn't really helpful.
Yeah, I learned my lesson once. I wrote out a ketogenic meal plan during my community rotation for a patient, and he was gung ho on keto, like he wanted it bad, but he wanted a meal plan. I spent, I don't know, I'm just guessing, 8 to 16 hours on it, only for him to follow 2 days. And he was like, "It's too expensive." I'm like, "Oh my god." So yeah, meal plans don't work, guys. Don't suggest meal plans for your patients. You can, by all means, provide sample meal plans that reflect a good balance, that reflect high quality proteins, simple foods that they can, access easily and that are budget friendly, but no meal plans, no specific meal plans.
Yeah. No, I agree completely. And we are creatures of habit. Like, we like what we like. So that's why I really like how we talk about those simple shifts and
Oh
things
yeah.
that patients can add into their diet to just
Mhm.
make it that much more helpful. Because, completely overhauling your diet is very challenging. If you've ever tried to do it, it's really, really, really hard. And usually you can't do all of that at one time. So I like those little swaps and those little things that you can suggest, instead of this, eat that, or add this in while we're learning to eat, more fruits and more veggies. So that works much better than, like you said, a structured meal plan.
Yeah, and you can take foods that can cross over from meal to meal. Like let's say strawberries. Strawberries can go into oatmeal. Strawberries are a side item at breakfast. Strawberries can go into a smoothie. Strawberries can go on top of a salad. So think about things that can be crossed over to other meals. That's not only saving money, space in your pantry, but it's also saving mental calories. Like you don't have to think about, okay, all these different ingredients that I need for all these separate meals. So there are staple items that, again, in those small, short lists, what are things that I can cross over, use for different meals? It just makes it so much more simple.
I agree with you. Okay, we talked a little bit about other things to track besides weight with our last patient, but I'm curious if, like, in your experience for the older gentleman, right? He's probably retired, maybe, if he's 50s plus and he's one of the lucky ones. He may be retired. So, what types of goals or things have you found that are more successful or more meaningful for these types of patients to discuss and suggest as a goal than just their weight in general for this type of patient?
For the retired population, I love that population, by the way, because they are in this time where they don't know how to not be busy, but they need things to keep them busy. So a lot of times I see them become a lot more interested in their nutrition and care at that age. And they're just not as busy. That's really what it comes down to. But what also comes is they're more of a relaxed lifestyle. They're not getting up as early anymore. Their schedule has changed. They're sleeping in. Maybe now they're skipping breakfast. Maybe now they're going out with friends for a social lunch and then a happy hour with their other retired friends. So I suggest that even my retired people make a schedule for themselves. Like, keep a schedule as if it were your work schedule. You need to be putting in your exercise, your nutrition, and what are you doing for self-care and your mindset. So they do have the time to track. Most of the time they do have the interest to track. But if they're not, then have them write it down on a piece of paper. Anything is better than nothing. Tracking and accountability is anything is better than nothing. So if you can't get them to get on an app and log, then definitely have them keep a nutrition notebook, log a space for their daily walking. Are they tracking their steps? So when they're exercising, do you feel stronger? I want to work with that specific population on balance and stability and flexibility. So if we're talking longevity for them, exercise kind of shifts in terms of priority from a younger person to an older person. There are different priorities now. We're wanting them to, keep their bone density and stay strong and keep their balance and keep them flexible so that they maintain posture and balance in their muscles. So you have to really understand their schedule first and foremost, but also, like, I know he has type 2 diabetes. And one thing that we need to make sure of is that he's having a consistent eating pattern. And, I teach a lot of people the same way I do with my patients that have diabetes. I always want to promote blood sugar control. We don't want, like, ups and downs all day long. And they don't realize why they're like that. Why is my appetite up and down, up and down? Why is my blood sugar up and down, up and down? It's because they're not eating consistently. And when they're not eating consistently, they're having a huge portion of something at one time, maybe just dinner or a snack prior to dinner or even after dinner snacking. So we have to tell them providing your body nutrition is almost like a part-time job. Like, it's not something that we can just ignore, retired or not.
We talked about the quote best diet for our first patient, and you had mentioned high protein, high fiber. And I love that because it's not like intermittent fasting. It's not keto. It's not any of those, although it can incorporate that based on her lifestyle. But for this patient, being that he has diabetes and hypertension, is there a quote best diet for him that might also benefit him with weight loss?
If we're gonna actually choose a diet, something like Mediterranean would be great. I hate throwing diets anybody's way, like even Mediterranean or ketogenic. I don't like the labels. I would much rather say, let's do higher percentage of protein, lower percentage of carbs and fat. So like a 40-30-30, 40% protein, 30% carbohydrates, 30% fat. That tends to work across the board for most people or the average people. And then he can also do like more of a heart healthy diet. So a lot of the benefits of fruits and vegetables, they contain potassium and things that actually do fight against high blood pressure.
Whitney, this has been so helpful, and I've just loved all of the tips. I know the listeners are going to leave with so many actionable things that they can literally do when they walk in the doors to the clinic. So I appreciate your time. My last question I always give to my guest is for you to share where people can find you and share more about what you do for professionals.
Absolutely. So our website is alterahealth.com with 2 R's. We support clinics and patients. So we've got a community for obesity medicine patients to join that gives them support in between their clinical visits. We have experts that are joining and they can chat with dietitians, therapists, trainers. We have daily posts. We've got a YouTube channel, Altera Health. Our YouTube channel has a lot of provider tools on there as well, how to build your obesity medicine practice, how to market it. So just supporting the obesity medicine space in general and amplifying the amount of support that we can provide patients outside of the clinic walls.
It's so needed because in the clinic walls, and I say this all the time, we have like 15 to max 25 minutes with the patient, and that's not enough if you're really trying to spark change and help them achieve their goals long term. So I really love what you guys are doing. I think it's helpful for patients and providers alike. So I will link to all of that down below. Whitney, thank you so much for the gift of your time. I so appreciate you being here. We'd love to have you back, but for now, thanks again.
Thank you so much. Bye bye.